Hi, everyone. This is Dr. Sahana Sharan, and I head up the clinical operations for Tenet ACOs nationally, and I'm based at our home office in Dallas. In this segment, we'll review the current state of ACO quality measurement, Tenet's approach to ACO quality measurement, physician practice engagement around key quality measures, and our overall approach to improving the health of a population in our ACOs. So what is the current state of quality measurement within the ACO space? When an ACO enters into an ACO arrangement with the health plans, the ACO and the providers are held accountable to performance on certain key quality measures. And these typically are the measures that the health plans wish to focus on improving for the population. So an ACO arrangement with Health Plan A generates a set of quality measures. Likewise, an ACO arrangement with Health Plan B generates another set of quality measures, so on and so forth. And this visual here helps depict that. Ultimately, while the ACO arrangement creates tremendous opportunity for the providers, it may lead to disparate quality measurement programs across the different populations, leading to potential confusion for the providers. And this also leads to challenges in understanding where the focus on improvement efforts need to be. And often the providers may not know how they're performing or where they stand in their performance on the ACO arrangements until after it's too late to impact change. And this makes it increasingly difficult to providers to move the needle, to make an impact, and demonstrate success in managing a population. So having presented that ACO quality conundrum, what is the ACO network that you're a part of doing to address this? So regardless of the ACO arrangement we enter into, we have selected one set of core quality metrics that cut across the ACO arrangements we have. And we'll review these quality measures in a little bit. And also providing actionable reports to our practices around these quality measures so our providers understand where they stand with their overall performance and how they trend on these measures over time. Essentially, what could have been a disparate set of quality programs across several different ACO arrangements is now actually just one set of practice reports delivered periodically to affect change in delivering high-quality, high-value care to the members. In order to do that, we have built our data infrastructure capability to digest a wide variety of data sources. One of the key sources is the claims information we get from the health plans in our ACO arrangements. We are also interfaced with our hospital registration systems to receive alerts anytime an ACO member gets admitted to one of our ACO in-network hospitals. And currently, we are also working on interfacing with additional data sources, such as bringing in the lab data and also interfacing with the practice management systems. So we have one clinical database from which we are able to generate practice performance reports by physician, reports to facilitate member engagement by the ACO care management team, and information that can help us with risk stratification and better support our chronic and complex care management needs in our population. And here are the core set of ACO quality metrics we are focused on improving. And these measures cut across the various ACO arrangements we have in the markets. You are familiar with these measures. They include annual physical exam or annual well exam in the case of Medicare patients, breast cancer screening, colon cancer screening, cervical cancer screening, hemoglobin A1C testing for patients with diabetes, diabetes education, MMR vaccination for pediatric population, and PCP visit in a year. The last metric, the PCP visit in a year, is a metric that is included as informational to the practices because the member attribution is driven mainly by the member's interaction with the PCPs. And if the member hasn't seen the PCP in the past 12 months, there is a likelihood that the member may drop off from the attribution to the PCP. And for background information, attribution is driven by member visits to the PCP over a 2-year time period. Overall, these measures are actionable, preventative, and wellness focused. And if you're an ACO practice with attributed ACO members, you have received a gap in care report from us that flags the member that may be due for one or more of these preventative services. Earlier in the year, we started with 3 core measures and we have built on the initial set to add measures to those and address the low-hanging fruit opportunity that is actionable for the practices. And we'll continue to build on and update these measures on an ongoing basis. Let's review some details around annual physical exams and why a measure indicating whether or not an ACO member had their annual physical exam made it to the list of our core set of ACO quality measures. Per a key provision in the Affordable Care Act, health plans are required to cover the recommended preventative service without any patient cost sharing. Annual physical exams are one such covered preventative service, and these are billable services that are referred to as annual physical exam or wellness exam in the case of Medicare patients. But they can be key to also addressing multiple quality metrics in one visit, particularly if you're a practice that participates in a Medicare ACO, and Medicare ACO has 33 quality measures in its program. An annual well exam can be crucial and extremely helpful in comprehensively addressing a majority of the quality measures for the patient in a single visit. Further, an annual physical or well exam can be that gateway visit in early detection and treatment of conditions such as hypertension or diabetes that may go undiagnosed if the patient hasn't been to seeing their PCP in a while. Ultimately, the annual physical exam also strengthens the relationship with the member and helps reaffirm member attribution. In our next segment, we'll review the types of reports and the resources that are available to your practice to help drive the overall success in our ACO arrangement.